NHS Birmingham Eastern North covers the eastern half of Birmingham City Council, which is the largest single metropolitan authority in Europe. So we've got about 440,000 people living in the area. We have some of the most disadvantaged wards in the country. The majority of our wards are in the top 10% of deprivation for England and Wales. But we also have a number of wards in the northern part of the patch in particular, where we have a relatively healthy and wealthy citizenship, and we therefore also have significant health inequalities.
We identified a need that we needed someone to work with us on this.
And what struck us about Dr. Foster was they particularly seemed to understand the partnership element of the process.
This has never been a contract that we have let with an external organisation. This is a strategic partnership that we are developing with another organisation to improve the health and reduce the health inequalities.
PRIME is the Programme for Relationships, Intelligence, Metrics and Equality. It sets out to develop that new relationship with the public and also with other key partners and staff. It's grounded in a commitment to health improvement and tackling inequality, and it seeks to use the creative generation of intelligence to develop new approaches to health improvement and healthcare.
We had to do something different, something transformational and long-term and sustainable. And we wanted to better understand our population and understand those factors that we could positively influence and change in terms of lifestyle and behaviours. And if we carried on in the same way, in a non-systematic fashion, we weren't going to get any improvement for our population.
What we felt we required was a more tailored approach to enable people that hadn't accessed services in the past, or where services weren't appropriate for those people, to be able to access their health.
I think the programme is offering so much innovation. It's the innovation that it gives us to think about doing things differently, and I think a more rapid feedback in terms of, you know, these things are working but these aren't. It's linking the basic lifestyle messages to technology and how we get that out in a more visual way.
Bringing those health behaviours together with the generic commercial behaviours has allowed us to create a set of 10 typologies of different communities that live across Ben, which means that we can have a much better understanding of how we might approach some of those different subsets of communities.
And enables us to understand better not just where our deprived populations are, but where our unhealthy populations are. And it's thrown up some interesting challenges to the PCT. We've always invested a lot of our resource in those areas that are deprived. What the health typologies has shown us is that those aren't necessarily the populations and the areas where the population are most unhealthy.
We're particularly interested in looking at how we can really get GPs interested and excited about tackling inequalities. And we're working on an element of the programme called GP My Practice, which will give GPs access to a set of information about their patient profile, how best to reach them, what particular aspects of inequalities they've got concentrated into their patient population.
The work with Dr. Foster Intelligence has helped the PCT undoubtedly in its achievement against the world-class commissioning competencies. In terms of knowledge management and understanding our population, what it's demonstrated is that we have a coherent and a structured approach for analysing and assessing data and information, to turn that data and information into intelligence.
It gave us the opportunity to map our population, to segment it, to identify what were the key things that we needed to consider as outcomes, what were the things that were going to deliver our key strategic objectives, and then how we focused on that. I think the things that we now need to see happening is the improvement in our baseline, that we're moving along a progressive trajectory, and that those interventions are making a difference to our population and improving the health outcomes for our residents.
Over the next 12 months, we will be investing in a significant programme across the 5 areas of Prime to start giving different health messages to the public, but also having a process in place that will allow us to hear how that's being received and to redesign services so that we can make the most of people beginning to apply different health behaviours.